My name is Ajay Kirtane. I'm a professor of medicine at Columbia University Medical Center and New York-Presbyterian Hospital here in New York City. The RADIANCE-HTN SOLO was a randomized clinical trial that assessed the efficacy of ultrasound-based renal denervation with the ReCore Paradise device versus a sham control. Patients were taken off their medications. Patients who were hypertensive at baseline were taken off their medications and then subsequently randomized after meeting eligibility criteria to denervation versus control. And at 2 months, the primary endpoint was ascertained, which demonstrated a reduction in ambulatory blood pressure at daytime in the denervation group compared to the control group, which was a sham procedure. Subsequent to that, between 2 and 6 months, medications were added back to determine whether blood pressure could be controlled. And what was found at 6 months is that despite these medications being added back, blood pressure was nominally lower in the denervation group, despite less medications being added back. What this analysis looked at was patients in the sham group who remained uncontrolled, who were then subjected to a crossover denervation procedure to attain better control of blood pressure. And in this analysis, the crossover procedure was associated with a reduction in blood pressure. What is clear is that despite the fact that we have multiple medications to treat high blood pressure, there are many patients worldwide who remain uncontrolled. And for these types of patients, it's important to have potential adjuncts to the medications that we can already prescribe. Why is a procedure potentially favorable? Well, because it's always on. Unlike a medication that requires adherence to taking it, a procedure can remain on even if the patient's not taking medications. And so we felt that it's worthwhile to try to demonstrate that a procedure like renal denervation can lower blood pressure even in addition to medications that patients are already on. Specifically, the crossover cohort analysis was a look at blood pressure before and after a crossover procedure in an initially sham-controlled patient. So in other words, patients who were initially randomized to sham, they didn't get denervated, were added back on medications. And some of them achieved control. Those patients don't require a procedure such as renal denervation to achieve control because they're already controlled on medications. But for those patients that were even beyond a year, despite medications being added back by their physicians in an open label fashion, who were still uncontrolled, it was reasonable to offer them a sham, a control procedure or a crossover procedure in the sham arm. And so what we did is we, based upon eligibility criteria, assessed them, did the procedure, the actual denervation procedure to an initially sham-controlled patient, and then assessed what happened to blood pressure. And what we found is that at 2 months and at 6 months, blood pressure reduction is measured by ambulatory blood pressure monitor recording, were 11.2 millimeters of mercury at 2 months and 12.2 millimeters of mercury. These are systolic, daytime systolic blood pressures in these patients. And what that suggests is that these patients could be better controlled by the addition of the denervation procedure to the medications they were already on. Beyond efficacy, it's important to make sure that any procedure we do is safe. Thus far, the preliminary data from this analysis, as well as RADIANCE-HTN SOLO, and even from other trials of other devices, do demonstrate that renal denervation appears to be safe out to the follow-up that we have currently. But we do need longer-term follow-up, and any procedure is a procedure. It's different than taking medications. So that safety issue is paramount, should remain paramount in everyone's mind. And I think if we can show that the procedure has a safety profile that's acceptable, then that will sort of help determine for physicians where this therapy ought to fit into the armamentarium used to treat patients. The biggest question that I think everybody asks is which patients ought to be treated by renal denervation procedures. And it's not a one-size-fits-all sort of answer. I think realistically, we know that we have medications that are easy to tolerate and can be quite effective at controlling blood pressure. So for folks that are able to control their blood pressure that way, that's perfect. But there are patients who either don't tolerate medications or for whatever reason are not well controlled on medications. And for those patients, it is appearing that denervation, if long-term data can show that it's truly safe out to the longer term, might be a very attractive alternative. I think also for patients that have issues with adherence and so intermittently take and don't take medications, because of the fact that denervation is a procedure that in a sense is always on, then it could also provide an advantage in those types of patients as well. There are still more studies that need to be done, ongoing follow-up of studies that have already been done, where we need to have those data points out to later time points. But I think with all of that together, especially in the context of well-done sham-controlled studies, we have some pretty good information with regards to the efficacy of renal denervation.